Hi, I'm Taretha. I'm going to be doing a physical assessment, and this is my patient. All right. Can we stand 20 feet from the Snellen chart, and can you read this line for me?
Yes, absolutely. DEFPOTEC.
Can you see anything below that line?
No, I can't see anything below.
Okay. Can you cover your left eye for me?
Yes.
Okay. Can you read it again?
DEFPOTEC.
Okay. Can you read anything below that line?
No.
Okay. Cover your right eye for me.
Okay.
And can you read it again?
DEFPOTEC.
Okay. Can you read anything below that line?
No.
Okay. All right. If you don't care to take a seat. Okay. So now we're going to test your near vision. I need you to hold this 14 inches from your face and read the smallest line there if you can.
428,739.
Perfect. Okay. So I need you to hold this index card over your left eye for me.
Okay.
And then you tell me when you see my hands coming.
Yes. Yes.
Look straight forward.
Yes.
Okay. Okay. Do you care to cover your right eye for me?
Yeah.
Okay. Let me know when you see my fingers.
Yes. Yes. I can see them. I can see them.
Okay. Perfect. Okay. Alright. So now I just need you to follow my finger.
Okay.
Look straight forward at my finger. Okay. Our eyes both followed my finger the entire time. Okay. Now I'm just going to look at the general appearance of your eye. They both look symmetrical and they're in alignment with the top of your ear. Both eyes are the same color. Can you raise your eyebrows for me? Perfect.
Mm-hmm.
And there is eyelashes on top and bottom of both eyes. There is no redness, no swelling. Is it painful when I press against your eyes?
No.
Okay, I'm just going to barely press.
No.
Okay. The conjunctiva and sclera both look clear. Let's see, I'm going to pull down your eyes here. Lower lids are pink and moist. The lacrimal apparatus looks good. The tear duct is not. I'm just going to look at your upper lid. I know this is kind of awkward. It is also pink and moist. And the other is also pink and moist. Okay. Do you have any questions so far?
No.
So now I'm going to look into your eyes if you don't care to just look straight forward. Actually, I'm going to look with the thin line first. Just look straight forward. Both pupils are equal and reactive. Before the light, they were both about 4 millimeters. Both were brisk. Now I'm going to look in your eyes. Look at the other. So there were side, it was red with a gold disc around it, which would be the optic disc. I seen the retinal vessels. The color looked good. I didn't see any pulsations. The macula, there was a yellow dot, which was surrounded by pink, and there was no blood vessels in it. Okay, perfect. Do you have any questions so far? Anything about your eyes?
No.
Okay. Now we're gonna move on to the ears. I'm just gonna inspect the outside of your ear first. Okay. There's no lesions or anything noted. Both ears look symmetrical. The color surrounding them looks good. It's pink. Both ears are nice and warm. Like I already said, they're also in alignment with your eyes. The top of your eyes is in alignment with the top of your ears is in alignment with your eyes. There was no lumps. Was there any tenderness or anything as I palpated your ears?
No.
Okay. No swelling or discharge or anything like that. I'm gonna look in your ears. Get this one first. I'm pulling the ear up as I look in. That's good. Okay. I didn't notice any wax or anything in your ears. The inside of your ear was nice and pearly gray. No drainage or foreign bodies or anything noted. No redness or swelling of the canal wall. There was no perforations. It was flat, and the membrane, the tympanic membrane, looked intact. Okay, so now we're going to test your hearing. Okay, so what we're going to do is called the Weaver and the Rhine test. I'm going to touch this to the top of your head, and you should hear the vibration. And then I'm going to touch it to the back of your ear here on the bone, and then to the front. And what we're doing is we're testing from bone to bone and then to ear. Okay. So let me know.
I
You
can
hear it?
Mm-hmm.
Okay. Tell me when you. Let's do it again. Tell me when you stop hearing it.
Okay.
Tell me when you stop hearing it.
Okay. Okay.
We're gonna do it again on the other. You know when you stop hearing it.
Okay. Okay. Okay.
So what we were doing there is the bone to bone, the vibration should only last approximately like half the amount of time as you hear it through the air, okay?
Okay.
So now we're going to move on to the nose. I'm just going to inspect it first and palpate. It all looks symmetrical. The nose looks straight. Can you blow for me? Okay, perfect. Again, perfect. So both nares are patent. Have you noticed any drainage or any tenderness or anything like that? Okay. Alright. So I'm gonna look in your nose. Perfect.
Sorry.
Perfect. I didn't see any excess drainage. The color was nice and pink. There was no deviation of the septum, perforation, or bleeding. The turbinates were noted, no swelling or polyps. Tell me if you notice any tenderness or anything when I palpate your sinuses.
No.
Alright, and I palpated the frontal and the maxillary.
Yeah, no, they're not tender.
Alright, so now we're going to look at your nose and your throat, or your mouth and your throat. I'm going to put on gloves for this one.
Okay.
I'm going to first notice your lips and see if there's any like excess cracking, anything like that. And they both, well, upper and lower lips both look pink and moist. If you don't care, I'm just going to check your teeth. Show me your teeth. All teeth are intact. I'm just going to lightly tap on them. You tell me if there's any tenderness, pain.
No.
Okay, perfect. I'm now going to check your gums. Sorry, this is kind of awkward. I'm going to feel. Have you noticed any bleeding, anything like that?
No.
Okay. No lesions or anything noted on the gums. No tenderness. Oh, I'm going to need those again. I'll look at your tongue, actually. Okay. So if you can, just stick out your tongue for me. Just going to look at the appearance of it first, and it looks nice and moist. No lesions or anything noted. I'm going to look at the bottom of your tongue also. If you don't care to stick your tongue out for me again. Okay. Bottom of the tongue also looks good. No lesions or anything noted. The buccal mucosa looks smooth and moist. Now if you can stick your tongue out for me, I'm going to look in your throat. If you don't care to say ah. Right. No redness or swelling or drainage noted. The uvula looks good. The tonsils are on both sides. No exudate or lesions noted. And we already looked at under the tongue and the side of the tongue. Okay, I'm just gonna look at your trachea here. If you don't care to swallow. Okay, it looks like it's in alignment. Okay. So next we're gonna, I'm just gonna look at your skull and make sure that there's not any lesions or anything noted to it. Have you noticed any lumps or any tenderness or anything? Okay. I'm just gonna palpate your skull here. Everything looks symmetrical. And then your eyes both look symmetrical, eyebrows and mouth. Can you smile for me? It's also symmetrical, no drooping or anything like that. Let's see. I didn't notice any lesions or any parasites or anything, any movement in the hair. There was no tenderness or lumps noted. I didn't see any moles or anything to be concerned about. Just gonna palpate your temporal artery. And then can you open and close your jaw for me? Okay. And there doesn't feel like your jaws are locking up or popping or anything, does it? Okay. Let's see. Everything looked good with your face. I didn't notice any edema or anything just from looking. Okay. And then I'm gonna look at your trachea again if you can swallow. Okay, and it's in alignment. Can you flex your neck and extend it back? Okay, and side to side, is there any pain or anything noted with it? Okay. Now I'm gonna palpate your lymph nodes. Okay, so I'm looking for the preocular, the postocular, occipital, jugulo-digastric, submandibular, submental, superficial, cervical, deep cervical chain, posterior cervical, and supraclavicle. And I'm just going to feel in the front of your throat for your thyroid gland. If you can, swallow for me. Okay. And I did not see anything. I'm just going to listen and make sure that I don't hear any bruise or anything. I did not hear a bruit. The position of the trachea is midline. Okay, so now I'm going to move on to your skin, hair, and nails, which we already kind of looked at your hair. It doesn't look like it's nice and thick. There's no patching. Have you noticed any loss of hair from your head, arms, legs, anything abnormal? Okay, perfect. Okay, so first I'm just going to look at your skin here, and it looks nice and pink, and that's what you want, or tan, I guess, in the summertime. Okay, the color looks good. It's nice and warm and dry. Pigmentation looks good. Have you noticed any abnormal color changes in your skin anywhere? Okay. And like I said, it was warm, dry, smooth. I don't notice any swelling or edema in your arms. Skin turgor looks good. As you can see, when I pinch it here, it bounces right back, and that's what we want. I don't notice any bruising or anything like that. Okay. Don't notice any lesions. Okay. And I'm going to also look at your legs here. Okay. Skin turgor on them also looks good. No swelling noted. They're also warm and pink. Okay. I'm going to check your fingers here. What I'm looking for is cap refill. We want that to be less than 3 seconds. And as you can see here, as I press down, it bounces, it turns white, and then it bounces right back. That's what we want. Do the same to your toes. Capillary refill looks good. I also didn't notice any lesions or bruising or anything on the legs. Okay. I'm going to inspect your hair again. The color looks good. The texture, it's not brittle or anything like that. It's nice and thick. I don't notice any lesions as I'm looking. Okay. And then I'm going to just look at your nails here. Have you noticed any ridging, breaking, anything of the nails like that? They all look pink in color. Like I said, the capillary refill was good. I don't see any clubbing. Is there any questions about how to do a self-skin assessment? I'm going to also check and see for moles. And then with moles, what you're looking for is the ABCD. Any asymmetry, any border changes like irregular borders. If the color is changing from brown to blue or black, or if it's greater than 6 millimeters in diameter. And I also didn't notice any on the legs. Okay, is there any questions that you have about any of the assessments that we did today?
No.
Okay, thank you.
Thanks.